everyone. My name is Donna Gambino. I'm a licensed physical therapist and certified Pilates instructor. And I'm here today to just kind of chat with you about what patients and clients that I train tell me about their doctors. I'm kind of like a bartender. They tell me everything. So I see patients quite frequently, or clients quite frequently for training. So twice a week, 3 times a week, sometimes once a week. But everybody tells me their story in regards to the doctor. And sometimes it's not so great. And this is not a video to bash on doctors or to diminish anything that they do or the stress that they're under or the time constraints that they're under. It's just to kind of bring some of these to the surface. And I kind of did a little survey on Facebook and Instagram just to ask, like, what are your big complaints from your doctor? Since COVID, healthcare has changed. And a lot of people left the healthcare system. So it's hard to get a doctor's appointment. It's hard to actually get into the office and see your doctor. Sometimes you have to do the televisits and stuff. And, you know, I hear a lot of the frustrations in the population out there when they're seeing me. So I made a little list, and this is very informal, of some of the things that I've heard and then other things that people have told me in response to this question. So the first number one complaint from everybody is wait time. How they get to the doctor on time, they make sure they get there on time, and then they wait. Just had this happen to me recently. I waited 50 minutes for a well visit. That was kind of irritating to me. I can see how people get upset by this. Our time is valuable. We have other things to do during the day too. We have children, we have jobs, we have all sorts of responsibilities, and waiting for 50 minutes to get seen because the schedule's overbooked is not something that we're cool with. So maybe if time management is a problem for physicians or whatever, maybe they need to reevaluate the scheduling and how that's going in the office so that people can be happier and they're not having to wait. The other big category is listening. And this has been a huge, as a therapist, you know, and a trainer, we listen while everybody's working out. They're doing their work, they're doing their treatments and stuff, and we are listening to everything they say. So oftentimes we catch a lot of stuff that maybe the doctors don't hear because they don't have as much time. So that's a good thing because we can always report that back to the doctor. But if you're in a visit with your doctor, you want to be heard. And the complaints were like, they don't spend enough time listening. I talk, but they don't hear me. They are on the iPad or the computer typing in test results or looking for test results or, you know, viewing my notes or my history, and they're not paying attention to what I'm saying to them. I voice my concerns and they are not heard, or they've talked down to me, where I've used correct medical terminology to discuss my symptoms and the doctor diminishes that and talks to me like I'm a toddler. That was an actual quote from somebody. So the dismissiveness, that's not a good thing. We don't want to be dismissing anybody's problems, especially their gut feelings and their, instincts about their own health, because oftentimes those are what's leading us to the proper diagnosis. The other thing is they didn't make me feel like I was a partner in my healthcare. So, you know, they want to interact. Patients want to interact with you and kind of come to be a team together as far as working towards their health and fitness or, curing an illness and stuff. So they really want to feel like they're part of the team. The other thing is didn't talk to any of my other providers about my case. That's a big one. Sometimes if you're seeing your primary care physician and you've already been to a rheumatologist or an orthopedist or something and they're not all communicating as a team, that can be frustrating for the patient to constantly be reiterating what was going on and redoing every time you go, you answer the same questions to the different people and it's like, don't y'all talk? Isn't it all my chart? So that can be very frustrating. I can understand that one. Another one is didn't talk to, they didn't touch me. That's the one. As a PT, I touch people when they come for an evaluation. So we're doing a lot of tests, a lot of palpating into tendons and bony areas and posture and checking. And I've heard so many times, my doctor didn't even touch me. He just, said, okay, you have this, you have, a medial meniscus problem and go see the PT. So they should be touching you. They should be doing evaluations. They're taught those kind of things like we are in therapy as well. So they can get a really accurate and good diagnosis from doing a manual, evaluation of you. Didn't even mention PT, OT as an option for my pain control. I hear this one a lot, which is really sad for my profession because, PTs now are doctorate degrees. So we're very knowledgeable and very well trained to treat patients and to treat pain and all sorts of dysfunction. And if we're not being referred to the clients, they're missing out. The patients are going home, they're not exercising, they're not, living to their full potential. And PT should be something that's recommended, or OT if it's for hands, or activity of daily living, those kind of things. Doctors should be referring out to those other disciplines. They sent me to PT before I had any tests. This is another one, and it's a frustration with therapists as well. I know MRIs, CAT scans, x-rays, all that stuff's expensive, but I try to keep in mind that the patient is the consumer and they're paying for these services, and if they're willing to put the money out to pay for these services to find out exactly what's going on with them, then maybe, we should be a little bit more, open to having the testing done before they go to therapy. It's a waste of refund or resources to go to therapy with a diagnosis of low back pain or neck pain or knee pain and not have an actual diagnosis from a test. So if you have the test and you see, oh, that's a bulging disc or that's a medial meniscus, then the therapist can be very accurate with their treatment. They can maximize their treatment time during the time that their insurance allows for them to come to therapy and how many visits, and we can really do a lot more for the client than kind of treating and shooting in the dark when we don't know what the diagnosis is. So that's a frustration for them. Anyway, so I want to just talk about a little bit about how to be your own healthcare advocate. So when you go into the doctor's office, how should you prepare? First, when the doctor comes in, let them sit down and wait till they look at you. That's one of my big advice to you is make the doctor look at you. Let me look you in the eye. When I'm doing an evaluation, I try to get down on the patient's level. I sit there, I look at them, I listen to what they're telling me. Keep them on track. A lot of people tend to wander with their histories and stuff. You can always bring them back to that, but paying attention and really having them look at you while you're discussing what's going on. One, get ready for your visit. Okay, so write down everything. Maybe the week before you go, start keeping a list in your notes in your phone of symptoms or, times when you have pain, things that you notice that are different. Just make a list, a laundry list of all your problems, things that you really want to discuss, because you'll forget. You get in there, you get nervous, they're rushed, you feel rushed, and then you get home or you get in your car and you think, I forgot to ask them about this. So, your pain problem description, any research you've done, and just stepping back out of that one, watch what you're researching on the internet. Don't just look at any random site. That stuff's not regulated. Make sure you go to reputable sources to get information. Mayo Clinic, Cleveland Clinic, resources like that to get good diagnostic technique tests that should be done. Print that out, take it with you. And you can ask, oftentimes they have a list or they have questions that you can ask and tests that should be done or might be done if you have that diagnosis. And if you have that with you, it's just going to help keep you on track. Any books that you may have read in regards to, maybe diet or a type of diet you want to try. Put your little sticky notes in that thing and open up the book, tell them what you've read. Say, could that be for me? Just to have a dialogue and a discussion about how to be, a team together for your wellness. Of course, list what you've done at home as far as treatments or things that have made things better. If you're suffering from pain, okay, I've done this, that's helped. Any alternative medicine treatments that you've done, acupuncture, massage, chiropractic, anything like that, vitamins, essential oils, whatever you've done to maybe help with your pain, and have that list there so you can tell them what you've already kind of crossed off the list. All right, challenge any treatments that maybe they say, hey, I got a drug for this, I'm just going to give you meds. You're not someone that wants to take a lot of meds. Challenge that treatment or the treatment advice and say, what other options are available to me? Say maybe I need to take some time and research this first, look into this a little bit more before I jump into you calling in that medication right away. There could be some other options and stuff if you don't like to be on medications. One of the big things, don't let them leave the room until all your questions are answered. If you have all your questions written down, leave space between them and write down the answers. Don't let them walk out that door until they answer your questions. And you're paying for that time in the office visit. And a 5-minute in and out sometimes just doesn't get that done. Listen to your gut. If you're hearing stuff and it's making you feel like, I don't know, this is not what I've heard from my friends who have the same diagnosis, or I've heard, in research that I've done and stuff, listen to your gut. Often your gut is right. And then do the feedback questionnaire. So after you're done with your visit, usually most healthcare systems will send you, rate us on a scale from 0 to 10. Okay, now I'm going to talk about this a little bit because I do those all the time. I do them frequently. They've been doing those studies or those questionnaires for 20 years plus, okay? And a research study that I just read from the NIH study said the impact of satisfaction survey results on hospital quality improvement led to not much change. Only they saw changes in the hospital environment. So you say, oh, it was dirty, or it was, disorganized or something like that. Hospital environment would change. Maybe the way they schedule people would change, those kind of things. But with those customer survey satisfaction things that you take, they didn't see a significant change in actual interpersonal relations with patients, which is sad. So what do we do? What do we do from there? As patients, as people that are going in for a service, what do we do? Do you have suggestions? How do we get the healthcare system and people to listen to the people that are coming to them for their own healthcare and their wellness? And if we're doing these surveys, why aren't they working? Why are they not talking to the staff there at the hospitals, outpatient clinics, wherever, and having maybe personal development courses or things on interpersonal skills or whatever, just to see if we could get some change in that so patients can feel heard and they're not going to their therapist and just spilling their guts on how dissatisfied they were with the care they got, because that's not fair. And we all got into this field to help people and to make people feel better and to feel heard and to see improvement, and we're not going to do it if we're not listening and really listening to what the population wants. So I hope that was helpful. If you have any questions, drop them in the comments box below. You've had similar situations. What are your pet peeves from doctors and in the hospital or in outpatient settings, things that have really kind of upset you? How did you handle it? And if you'd like to like this video, that would help the views and would also help me. And if you have any questions about things you'd like to discuss in the future, drop them in the comments box below, and hope to see you soon.